Good evening and welcome to another edition of the District of Illinois Fireside Chat Series. I am Brother Leonard McInnes and I serve as the Illinois District Director. I am joined on screen by Brother Chuck Smoot, who is the Illinois District Historian, a member of the Regional Historian Committee for the Midwestern Region, and also a member of the Membership Development Committee. Listen, do us a favor. Tonight's conversation is important. Most Black people, African Americans, have known someone who has fallen or succumbed to colon cancer. In fact, in 2020, at the age of 43, Chadwick Boseman passed away from this awful disease. Tonight's conversation is a serious one. It is one that men of Alpha we must have. We deserve to live. We are very excited about the panel this evening who will give us the best possible resources, both for colon health, but also the psychology behind what it means to go to the doctor and do what we must do as Black men, as a Black community, to take good care of ourselves. Before we get started, do us a favor, share this chat, share this live stream, click share it to your friends, text someone, say, listen, I need you to log on for 1 hour and hear this discussion. Brother Smoot, welcome again to the Fireside Chat.
Thank you, Brother District Director, Brother McInnes. It is a pleasure to be here with you again, and I agree. It's I take this this hits home with me as well. You mentioned Mr. Boseman, but I also remember one of my early mentors from high school. They passed from colon cancer that they did not get checked out, and once it was identified, it just spread very, very quickly. And so this is an important discussion to have because of encouraging people in our community, Black men, Black women alike, to take their health seriously and be proactive about it. And I think that's one of the things that we are going to talk about tonight is different ways to be proactive. So I'm looking forward. I'm looking forward to the conversation.
And Smoot, Brother Smoot, let me just say this. The idea of being proactive about our health is a conversation far too often that we avoid in our communities.
Right.
And it is one that, as men of Alpha, we cannot shirk this conversation. As I often say to men in the district, we deserve a chance to live like every other community.
Absolutely.
And for many men who I have met, Brother Smoot, and some women, there is the psychological barrier about simply going to the doctor and doing what must be done. I'm going to give a personal story, Smoot, that you know already, and then I'm going to let our panelists come to the stage. In 2004, at the age of 47 years old, my father learned that he had cancer. And what we also learned is that my father had not gone to the doctor in many years, right? And so what could have been caught much earlier was not caught because he did not simply go to the doctor and do what must be done, the test. Some things, we can't avoid certain things. We can do our part in keeping our health up to speed. So I want to say this, Smoot, I look forward to this conversation. And at this time, I would like to invite our panelists to join us upstage so we can have this important conversation.
All right. Excellent. Brothers, welcome.
Thanks for having us.
Thanks for having me.
So everyone, we have this great panel with us tonight. We have the distinguished Dr. Brian R. Humphrey and the distinguished Dr. Douglas Jones. You see that both of them are making me bad because I'm the only one not wearing a bow tie tonight. So I'm feeling a little insecure, tonight. But I guess that's how you doctor brothers do things.
Nah, brother, you looking good. You looking good.
But it is a pleasure to have you, and we are very happy to have you to have this important conversation. Real quick, I just want to let our viewers know a little bit about your backgrounds. So I'm going to start with Brother Humphrey. Dr. Brian R. Humphrey is a licensed clinical and prescribing psychologist and founder of Psych Energy Behavioral Health. He's a pioneer in expanding access to integrated mental health care and the first African American male in Illinois, licensed as a prescribing psychologist and among the first in the United States. Dr. Humphrey advances an integrated model of care that unites psychotherapy, psychological testing, and medication management within a single continuous provider relationship. He also serves as the first and current Surgeon General for the District of Illinois and the Midwest region of Alpha Phi Alpha Fraternity Incorporated, where he provides strategic leadership on health initiatives, advanced policies that promote member and community well-being, and guides the development of public health programming aligned with the fraternity's mission of advocacy, service, and health equity. With more than 2 decades of experience across community, academic, forensic, and private practice settings, he provides a comprehensive, evidence-based care grounded in psychological assessment and integrated treatment planning, alongside consultation, clinical supervision, training, public speaking, and authorship. His work is grounded in culturally responsive, evidence-based care informed by structural and social determinants of health, with a focus on strengthening continuity of care and improving access and outcomes for marginalized, underserved, and culturally diverse populations. Next, we have Brother Dr. Douglas Jones, who is a general surgeon diagnosing and treating diseases and injuries requiring surgery care, and also serves as an assistant clinical professor of surgery at the University of Illinois at Urbana-Champaign Medical School for the last 11 years. Dr. Jones specializes in robotic breast and laparoscopic surgery. He is the first surgeon in Champaign and surrounding communities to introduce laparoscopic cholecystectomy. I don't know if I pronounced that correctly. Using single-site Da Vinci robot techniques for gallbladder surgery. Dr. Jones has been ranked 12th in the nation for volume of surgical cases performed and is committed to giving patients the best information and technological advice in the field of medicine so they can make informed decisions. Dr. Jones received his bachelor's degree from Virginia Polytechnic Institute and State University in Blacksburg, Virginia, and a medical degree from the Morehouse School of Medicine in Atlanta, Georgia. He was a Fogarty Fellow at the Harvard AIDS Institute in Boston, Massachusetts, and completed his residency training in general surgery at the top-ranked Cleveland Clinic Foundation of Cleveland in Cleveland, Ohio. And Dr. Jones is board certified by the American Board of Surgery and a fellow of the American College of Surgeons. He is also a former member of the 3rd U.S. Infantry, the official escort of the President of the United States, and a former guard of the Tomb of the Unknown Soldier. And in his free time, Brother Jones enjoys public speaking, mentoring, traveling, sports, music, fitness, and spending time with his friends and families and being annoyed by his fraternity brothers. So, brothers, doctors Humphrey and Jones, thank you again for appearing with us tonight for this. This is part of our ongoing effort to discuss issues around men's health, around health in general, but particularly men's health. So I want to start tonight's conversation with, maybe the most obvious questions, and I'll throw this to you, Dr. Jones. Why is colon health important? Why is looking after gut health important, not just in general, but for those in our community?
Well, for the medical community, we consider colorectal cancer a preventable disease. So that's what makes it first and foremost so important to get screening and to get tested for it. Because as long as you catch it early, when it's just a polyp, you'll never have to see somebody like me. You know, the surgeon doesn't come into play. As long as we just remove the polyps, you continue your surveillance. We remove any further polyps that may develop in the future, and it keeps you out of the operating room. Once it develops into a cancer, unfortunately, you know, you're always at risk of having a mortality from that, not making it. And if you do have an operation and you survive from it, there's always a risk of morbidity. Things can happen. You can get a hernia, you can get blood clots, you know, you can have all kind of different things from an operation. Now, with that being said, if you're an ideal candidate or you're reasonably healthy, those risks are low, but they're not zero. So we always want to catch things early. And if you can catch it before it becomes a cancer, that's the earliest you can get.
Absolutely. And so, Brother Humphrey, can you address what are some of the barriers, you know, psychologically speaking, that prevent people from, you know, getting regular checkups, but particularly in dealing with issues of colorectal health?
Yeah, absolutely. Thank you for the question. You know, I think one of the largest is like stigma and embarrassment. I believe that, you know, it's kind of it can be a taboo topic that is discussed when we talk about health in general, but it's specifically where men are thinking about identity and issues of masculinity, just given the nature of the colon itself. So there's often limited discussion that can happen about that because it's uncomfortable. It's not something that we're publicly talking about amongst men, amongst even our loved ones. And so therefore there can be a reduction in health literacy because there's no discussion of it. So there's sometimes misconceptions, stereotypes, beliefs about what the procedure might entail. There's fear. That's a very, very real psychological phenomenon as well. We just heard briefly through the district director explain how his father, you know, unfortunately, by not taking a priority of his health, we don't know, it could have been because of fear, but in many cases, men are not asking questions for fear of what they may find out. You know, and so sometimes there can be a phenomenon where the individual is in denial or there's a fantasy belief that, well, it's not going to happen to me. It's okay. What I don't know can't hurt me. But in actuality, it very much can. I think that a lot of individuals just overall may struggle with lacking the information or sometimes feeling the support. What will others how will they judge me? How will others see me? How will I see myself? How do I deal with, you know, the realities of what may come from this? And then ultimately what also, you know, may come if I do share this with individuals. And how do I see myself in proximity to the totality and the wholeness of my health?
And so I'm curious, you know, kind of piggybacking off of that, the kind of self-image, the self-awareness issue. Brother Jones, how do you address those issues with patients who may be suffering from, and I guess suffering for lack of a better term, but suffering from some of those psychological issues that Brother Humphrey just raised?
Well, first and foremost, we try to relay that this is a professional procedure. Everyone in here, we perform these hundreds of these throughout the day and depending on the facility. And you just want to let them know we're there to help, to get them healthy, to keep them from becoming a statistic in the way of getting an actual cancer. You know, like I said, once again, it's preventable. So we try to relay that this is a procedure, and more than anything, they're asleep during it, so they don't have to worry about feeling violated, because actually the medications we use during the procedure will give you amnesia. So I think once we kind of explain the procedure and go through everything and really relay the reason we're doing it, and it's no sexual connotation to it, then I think that helps them to feel much better. A lot of people, unfortunately, think the colonoscopy is using a scope that's a lot larger than it is. So just showing them how the size of it, because it's pretty much the size of one of those fat black pencils we used to use in elementary school. All you young bros, you're not going to get that reference, but you can look it up on Google after we get out of this chat. But it's not a very big scope. And once you kind of relay, there's no sexual, invitation around it and things like that, and you explain why you're doing it, I think that's enough to get them around. Now, what's very important that, I graduated from Morehouse School of Medicine, so this was a big point in my medical school. A lot of times, our people, they're kind of brushed to the side, hurried along, and there's not really that kind of conversation going on. So that's the key point, just making sure somebody really sits down and takes the time to let them know what's going on and to relay it and make sure they get it instead of just rushing them along. You need a colonoscopy. We're going to set you up and just give them instructions and push them out the door. That's not the way to go about it. So that's what needs to be improved upon from our side as physicians and as providers.
So let me ask, and I don't have the stats on this, but I know Black men in particular sometimes are more prone to certain diseases than other diseases. Are Black men at a larger risk for colorectal cancer or colon issues than our other counterparts? And I'll throw that out to anybody to address that.
With all things being equal, yes, there is a slight increased risk for us with colorectal cancer.
Okay.
Correct.
Okay.
Unfortunately, piggybacking off of what we just talked about, we tend to get our diagnosis and we're a later stage, which makes our survival rates even worse. So that's part of the problem as well.
Yeah, and there's also, if I can jump in, also like we said, a psychological component, but also sometimes a societal problem as well, or a systemic issue where there are sometimes incidences of like the food that we eat. So if we have like food deserts or unhealthy food options, and the Black community sometimes, depending on what you put in your greens, if you got your, your neck bone, the hog maw, whatever you put in there, these kind of, things increase your risk factor for cancer in general. And so sometimes just as African-American men, even our diets can sometimes raise the risk for that as well. There's also like these structural and systemic issues too, like access to care insurance. Sometimes a lot of insurance panels, it was only of a number of few years. And Dr. Jones, definitely please correct me if I'm wrong. I think it was only within a few years where the guidelines for when you actually get the examination changed. And so for African-American men, I believe the guideline was always a little lower. The age to which you had to get was a little bit lower, but now it's been reduced for all men. It's about the age of about 45. So, for example, if you
are correct on that. And just one thing I'd like to add, since we're talking about age, everybody should get screened at 45 because unfortunately the disease is starting to kind of mess with a lot of people a lot younger than it used to. And on top of that, if you have any kind of increased risk factors, i.e. like a family member and things like that, you start getting your screening 5 years before that. And if you got a genetic predisposition, we even go a little earlier than that. So if any of your loved ones have had colon cancer, then you should start at 40 years old.
Mm-hmm.
So I want to piggyback and ask a question that is going to make some people uncomfortable here. But Brother Humphrey said something, in terms of diet. So are we saying that people should really cut back on things like chitlins and pineapple on pizza? That those are things that probably contribute to it, especially the pineapple on pizza thing, which is an abomination anyway.
We all think you should strive to eat the healthiest diet you can.
Right.
We're finding more and more, and everybody knows this, the ultra processed foods are not good. So as a brotherhood, we should push all of us to do better. We need to get more to whole foods, raw vegetables. If you cook them, try to use the better oils, whether it be an avocado oil or, olive oil, things like that. And you want to eat raw vegetables. You want to also eat raw fruits for the fiber and the nutritional value, and lean meats. And I'm not saying everybody should try to compete in a bodybuilding contest or do anything like that, but at the same time, we should be very concerned about our health. And, some of the risk factors are actually, as far as the way you diet and also conditions. So we had talked earlier, and since we're kind of talking about things we would want to do to help, the big three for almost any disease process, anybody in medicine, the three things we do not want. So you don't want to have diabetes, you don't want to smoke, and you don't want to have high blood pressure.
Right.
Yeah, those are things you want to try to decrease as much as possible. Uncontrolled diabetes is a very terrible thing, and I will. It's a little outside of colon cancer, but I think it's important. If you have loved ones with high blood pressure or diabetes, those effects are not felt quickly, but they are detrimental because you have blood vessels that go to every part of your body. So you can develop strokes, you can develop heart attacks, you can lose lower limbs. Most of these people you see walking around is not that they were in a war. They actually had uncontrolled diabetes and require amputations.
Right.
And your kidneys are part of this as well. A lot of kidney failure comes from these kind of things. So we'll get back on course with the colon cancer now, and I'll relinquish.
No, I think that's important because I think this is a larger part. This is a larger part of the discussion that we need to be aware of, and not just. I think sometimes in these conversations we kind of segment things and we don't necessarily talk about the interconnectivity of these issues. So I think you raising that as a point is very important to look at things as a part of overall health. Now,
if I could just jump in, just one more,
absolutely.
Just real quick, just one important one important component, just hydration. I think that sometimes we all can fall into this risk of like being just dehydrated or not having enough hydration. So that's also a risk factor. So just by hydrating oneself, drinking like recommended doses of water per day, and movement can be really also important protective factors against that as well for all of the conditions that we were really talking about. Just staying hydrated as well. But my bad, brother. I didn't mean to interrupt.
No, I'm following doctor's orders. I just took a sip of water. But in terms of talking, I mean, I think one other issue that, and correct me, that we pay attention to is weight, and being concerned about weight and how we carry our weight. And we're now, the GLP-1s, Ozempic stuff has gotten very popular, and with more and more people using those medications. How does that impact colorectal health, particularly because there are potential like protein diets or something that people are advocating to offset issues if you're taking GLP-1s. And so for any of our listeners who may be on taking that type of medication, what would you suggest, or how does that play into these issues?
I'll definitely, defer to Dr. Jones, but I know that a lot of the patients that I see that we want to make sure for sure of is that I know that the medications can definitely slow digestion. So that can a lot of times cause like inflammation, constipation, gastrointestinal like discomfort, bloating, things like that. So I've also seen a lot of individuals getting a lot of these medications like overseas, like ordering them online and things. And so just as a general kind of reminder, always, use any medications, as prescribed under the guidance and the direction of a licensed professional, preferably somebody who has an awareness and a sensitivity to cultural variables, but not just something that you're just kind of seeing on the news, or you see on an ad and say, let me try this. You just want to kind of make sure that your doctor is aware of that and can inform you and direct you on if that's the best solution for you or how that would be used.
As of right now, we can't give you as a medical profession any recommendation because this is kind of new as far as how it relates to a colon cancer in and of itself.
Right.
The high protein diet, of course, it depends on the kind of proteins. Like we said, the preferred lean and the ones that we use for nutritional diets from a standpoint are the ones that we recommend. Those should still hold true and be okay. The thing that was brought up that was brought up by Brother Humphrey is absolutely correct. It slows down the GI tract. And, there are starting to come out with some complaints that patients are developing gastroparesis and other things like that. So once again, it's the whole thing we were talking about. You need to, under physician's care, and talk to your physician. So if you notice that your intestinal symptoms are getting worse, or if you notice your bowel movements are slowing down and you're having a hard time eating and it's starting to progress, that's something you need to know before you can do some permanent damage. You do not want gastroparesis. That is actually a rather bad thing. And for anybody who's not familiar with that term, gastroparesis is when your stomach basically stops contracting and putting the contents into the intestine.
Okay.
So the whole intestine is smooth muscle. Smooth muscle you do not control. Your body controls that.
Gotcha.
So you don't tell your heart to beat. You don't tell food to go from your stomach to your intestines. A woman doesn't tell the uterus to contract. You don't tell urine to go from your kidney to your bladder. So your body is taking care of all those functions. And if that starts to slow down, that could be extremely problematic. So you want to stay on top of that.
Gotcha. Now, I want to ask, because it was mentioned a few moments ago of people who, search things out on the internet and, find out certain things. We all know that there's a lot of information on the internet, on social media, and that some people will take their health advice or their health cues from these so-called influencers or what have you. What would be your recommendation on, I guess, for lack of a better term, how to discern the quacks from the legitimate ones? I mean, obviously talking to your actual doctor is preferable, but people are going to be people, and we know that they're going to pay attention to certain things that they see on social media. So in what ways do you see to determine the real ones from the ones we need to stay away from?
Yeah,
It's very difficult. Very difficult. So I'm one of the kind of docs I like for people to try to get as much information as possible. So I don't mind the internet and going to look up things. But what I will say with most of my patients, the caveat is you just don't know the percentages. So you can look up things and to you think they're all the same. But for me, I know one diagnosis is a 1 in 10 chance, and the other diagnosis is like you buying a lottery ticket and hitting the lottery, so the odds are not always the same. So that's something that you should discuss with your physician or somebody you're comfortable with. Of course, nursing staff and other people in the medical field, they can give sound advice as well. But there is a lot of stuff out there, and unfortunately, because of the way production is and things like that, if they have a great looking set and they look professional, everybody can talk the talk. But yeah, there's a lot of stuff out there that's stuff we don't agree with as a medical society, and I can understand why some people are apprehensive about physician or about the medical profession, because listen, we deal with life and death situation, and if somebody's grandmother had a bad outcome, of course you're going to be skeptical. So I understand all of that.
Yeah, there is a healthy, like to your point, I think the skepticism can also be healthy. There's a healthy skepticism. We have a reason sometimes you should be cautious and kind of question certain things. I know the two, you Brother Smoot, you brought up one, like, a lot of these influencers, check to see what their credentials are. Like everybody is, says my treatment is the best, but, do they have a background? Do they have, training? Are they licensed, et cetera? I get a lot of patients that are, I always say, Dr. Google, like people will Google things, but the danger really in Googling and using Google as a pure source of information is that, it's all based on algorithms, right? So if you're like inputting certain things, the hits are usually going to come from based off of what a lot of people are searching for. So you may get a miscued look too. You may see like, oh, is this okay? And if a lot of people are searching for that, that may be rising up in your search list. And so you might actually be presented with information that is influenced by the algorithm versus it actually being, authentic quality information that you should take. It should be personalized, which is why you always want to talk to your doctor. And so I tell people all the time, like, if you are looking online and you're doing the research, Dr. Jones's point, inform yourself, but be a skeptical connoisseur of what it is that you take in. Like I tell my daughter all the time, don't just read things for the sake of reading things,
Right.
and then all of a sudden assuming like that's the fact, right? Like
Right.
always look at the source. Like,
Right.
is it from a reputable place? Is there even a source? Is this just somebody's opinion, right? So you want to often look to see if there is a reputable source where it comes from, usually a medical source, for example, American Cancer Society, CDC can be, sometimes they produce, statistics and information and things of that nature. So, just, I think one of the ways that you really differentiate it is like sometimes looking at credentials, look at like history and just of the individuals, like, are they experts? Like, Dr. Jones, he does this. Clearly he's gone to school for this, but if you go to somebody who's an influencer who kind of woke up and they said, this works and this solves all things, look for those kind of things too. These promises, like it's guaranteed, because
Right.
Science is sometimes not always exact in that way. So there's usually not a quick fix. It's always a flag when you start hearing kind of these claims and these promises based off of things that are not always corroborated by science.
I think with the with people who look to the internet and are looking to social media, one thing that they are doing, or at least in their mind, is they're trying to advocate for, get information and advocate for their own health. And kind of going back a little bit to something that was mentioned earlier, I can't help but to wonder also, and I think Brother Jones, you mentioned it earlier, that there have been times when Black men, I guess the better question is, what are the ways, what are methods for us, particularly Black men, to better advocate for their health in terms of ways they can really communicate with their doctors about their health issues, and requesting different tests or information related to their health? Like, what are ways that can be done for us to be better stewards of our health when it comes to interacting with our physicians?
So I think the best thing to do is actually a mindset shift. If you switch the way you think about it, I think most of us in the African American community, we feel like when we go in to see the doctor, something is going to get done to us. We're like there and we're twiddling our thumbs, we're anxious and stuff like that. I think the best way to proceed with the way you interact with healthcare from here on out is physicians, physician assistants, like what we call advanced practitioners, nurses. They are your partner, or if you want to, you can even think about them as they're your employees. Their job is to take care of your health. So if you walk into a hospital or you walk into a clinic and you feel like, hey, we're in partnership to make sure I stay in the best health as possible and I live to my 90s and I have my full faculties. When you have that mentality and you sit in the room with them and you feel like they're your partner or they work for you, as long as you don't have an attitude of being rude and treating them like they're beneath you, if you're working with them, I'm not rude to my mechanic. I'm not rude to people who do my yard work,
Right.
and they provide a service for me. So I think people should walk in with the mentality that we're working together to keep me as healthy as possible. And I think that one mind shift will do more than anything else I can say.
Absolutely.
Yeah, I love it. I think and there is an inherent like power differential, right? So a lot of times, when we like when I see patients, they will kind of defer to me and say, "You're the expert, so just kind of tell me." And so it can kind of set up this kind of hierarchy where what I kind of say is the gospel. You're depending on me to kind of provide you with all the information. So I always encourage people to go armed and give yourself the permission to ask questions. It's okay to, respectfully push back, or to make sure that you understand and are informed on different procedures or on different recommendations, in the case that we're talking about now, just your colon health. So, being able, self-advocacy is not a form of disrespect. It doesn't mean that you're claiming to be, greater or the credentials of the person that you're working with. It really is a team sport. So if you're working with the individual, you're learning together versus, hey, I'm going to throw you the ball and now you throw me the ball. You all can both work in tandem to be able to figure out what is ultimately best. So definitely want to, prioritize self-advocacy and being able to speak up and to be able to ask those questions and not just kind of take the things that are said to be the case. I'll just share very briefly also a personal example. So I turned 45 last year. So I knew, that I would have to get, colonoscopy as well. And it was the end of the year. And I wanted to make sure that I had utilized all of my benefits of my insurance and so forth. But when I had called, I kind of got put through the system, and they were just like, oh, you can get that, really 46 is okay. You can get that pushback. I said, no, I really do want to get that done sooner than later, and I had just turned 45 too. So I know I had, some time, but it's not like an absolute, it has to be done at 45, on my birthday, it has to be done. But I knew I didn't want to wait until what they were saying at the time would have been this time, around this time, this week, within this month, the month of April, is when they were saying, oh, that's when the next availability was there. And so I really talked to the nurse and really, with respect, said, I respectfully, as an African-American male, I know that I have a higher risk for certain things. Let's not turn that to risk if we can. If there isn't any opportunity or any way that I could be seen sooner, or if there's anybody, in the clinic or a referral that you can give me, I would really appreciate that. And she very much, was receptive to that. And, sometimes they don't know over the phone, they don't know who you are. Sometimes when they look at your demographics, they might not have that information. But in fact, they were able to get me in within 2 weeks. Not because they knew of who I was as a doctor, but just simply because I advocated and I really insisted on saying, this is my health. This is a priority. This is important to me. I don't want to compromise this. Work with me. Help me to, prioritize and get this taken care of. If I hadn't, then I would have probably waited until now, and so it's okay to push back with respect, but ultimately do what is best for your health. And sometimes talking to your medical provider, talking with the medical team, and again, being informed of the statistics and the data will help you to know kind of what to expect and what to advocate for.
Absolutely. And I think that's important. I think when it, coming back to, requesting, now we've talked about, and I just want to put a little emphasis on it, that you just brought it up, Dr. Humphrey, and both of you mentioned it earlier, but that previously the idea was to get your first colonoscopy around the age of 50. But now that recommendation is being pushed up to as early as 45. Is it, just to be clear, that is the current recommendation, correct?
Correct. And if you have any risk factors, it's even earlier.
Yep.
And one of the reasons it was moved up is, unfortunately, we're starting to have more and more patients in their 20s present with rather advanced colorectal cancers.
Right.
I personally had a patient, I did her first operation when she was 23. That's when she got the diagnosis. She unfortunately passed away. She was able to live a long time with that diagnosis because hers was advanced. And I think she ended up passing away at the age of 29.
Okay.
There's reports of kids in college. So I will say to all of the brothers that's on this call, and spread this out to everyone you love, everyone you know. If you notice blood in your stools, definitely come in to see somebody so that they can do an emergent colonoscopy, because you want to catch things soon. And bleeding is not a early sign. So, it definitely needs to be evaluated right then, because it's unfortunate that I know so many people personally that have put off a bleeding as a sign. Now, most of the time, just so everybody knows, most of the time it is going to be something like an hemorrhoid. Right. It's not going to be a cancer, but it's not something you can ignore, especially if it's not like a random thing. If it's happening every day, that needs to be evaluated.
And 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 I think of now, going along with something that Dr. Humphrey said, so I had my first colonoscopy when I was 48, and I'll be honest, I put it off for a while, and mainly because I was afraid of the procedure, because it was the myths about them sticking a big old hose somewhere I was uncomfortable with. And I shared this as we were preparing for this. That wasn't the worst part of the of the procedure. The worst part was that stuff that they gave me to drink that was just absolutely disgusting. And I thought, like, I'd rather have 3 or 4 of those things stuck up me than drink that stuff again. And I'm making light of this a little bit, but kind of on purpose, because when I talk with my friends who have had colonoscopies, consistently, that is the thing everyone complains about the most, is that nasty stuff that they made us drink. But we get over it quickly enough. Now, for transparency's sake, you guys mentioned nurses a couple of times. My girlfriend is a nurse, and so I told her,
you're lucky on that. She's going to keep you in a good place.
I hope so. I hope so.
Women who do not know medicine take care of their men when it comes to medicine. So if you have a woman that's in medicine, she's going to really take care of you.
And she does her best, even though I'm hard-headed. But as we were, so I consulted her, asked her a couple of questions, like, what do you think we should bring up? But she did bring up the fact, and the reason why I bring up the drink mix that you have to take before colonoscopies, that was so disgusting, that there are now alternatives to the prep drinks. She mentioned something about a Gatorade based thing and something else. Like, do you guys know anything about that, or is that something that is
so as far as these bowel preps, a lot of people have turned to the Fleets enema along with tablets. We got things called Docalax tablets and things like that. So the amount of volume has gone down, because from what you're talking about, sounds like you had to do the Go Lightly.
Yes,
which
I did.
Back in the day was a 4-liter prep. That's a lot of liquid.
Yes, it was.
So most colonoscopies now, I think they do with the mag citrate, which is it's a bottle about the size of a soda can. Okay. And over the course of the day before, you do 2 of those bottles along with a lot of tablets, and you just drink clear liquids as long as it doesn't have any red dye. And the reason for not having any red dye is because you don't want to have anything in your GI tract that might look like a bleeding source or might look like something that's concerning. So no red dyes and things like that, clear liquids, even Sprite, sodas, things like that are usually acceptable for most GI docs. Me and my partners, we all got certain things we do just a little bit differently. We all trained in different places. We grew up in different places, so we do things a little bit different. And gastroenterologists, the people who mostly do the colonoscopies, along with colorectal surgeons, everybody got some slightly different things they might do with their bowel preps, which is okay. So in case you have a different bowel prep than some other doctor, it's not that anything is wrong. Docs can change it up a little bit.
Yeah, but I would say definitely it's, so that was my first time kind of experiencing it. And basically we were calling it the Game of Thrones around here. I was on the Iron Throne. I was on that thing. So, I would say, plan for it for sure. But to your point, Brother Smoot, I think that without a doubt, personally speaking, that was the worst. And I don't think I had really prepared for it. I had spoken to a few other people who, and I didn't have that option, Dr. Jones. So I did have like the full
So I got a little insight. So I did have that option. I didn't have to do that volume. So for my colonoscopy, I did the couple of soda cans and called it a day. And my gastroenterologist is actually one of my very good friends, and he said my prep was clean as a whistle. So you can relay that for the future for anybody else. Hey, I heard about this little mag citrate that's like a couple of soda cans, so you can get the good one.
Yeah, and I think that there's also like with like if you do, I guess I don't know, as you know, science evolves and medicine evolves, maybe that will become the norm. But I know that one of the things that was also different that they offered to me that they said that they don't always offer was like a powder, where it kind of gave it like a little bit more flavor. It kind of tastes like almost like lemonade. So it wasn't like, and I say that lightly, it don't taste like lemonade. I like the lemonade that like, you know, barbecue where it's like y'all didn't put like 1,000, you know, gallons of sugar in it. But it definitely wasn't as bad as it could be, but it was just, it was a lot of volume. You know, you had to drink. I think the instructions was like you could take it every and there's different instructions that they will also advise you, because when you go, they'll you know, teach you or train you on how best to do it. I took it all. I was like, I don't want to be sitting like every 10, 15 minutes. I just like took it all. Was done with it, and you know, I think that, you know, the prep portion of it, brothers, what you also mentioned, and I don't want to oversee that. You know, it is a blessing where you have that support. So being able to have individuals, you know, go with you, or you know, kind of encourage you, or stay on you, or hold you accountable, you know, can be really helpful. I know that for sure. My wife was very much, you know, kind of checking in, making sure I was okay, and you know, just providing reminders and things of that nature as well. So use your community, you know, use your loved ones, and hopefully we can get this. Whereas it's not, I'm not saying we're always going to have like a conversation where we're, you know, always, you know, watching the game and talking about some of these things, but definitely a friend or somebody who you can trust that can really help you with your health, given that this is taking us out the game and it's totally preventable. And so, you know, a loved one, a trusted individual, just somebody who, even if they're your age, you know, you all can keep each other accountable.
I will say for men, this is the most important screening test you do. Now, there's also another option for screening, and that's the Cologuard that you see about on the commercials. But the difference between Cologuard and a colonoscopy is you can't perform any intervention with the Cologuard. So the main point of a colonoscopy is if they see a polyp, which is not a cancer, you remove it at that time so it doesn't have the opportunity to turn into a cancer. So that's the most important part of the colonoscopy. You want that actual intervention component so that they can take care of anything that they see.
And so as we get ready to wind this down, I have two questions that have occurred to me, and one is about the language surrounding and the verbiage that we use surrounding this. And I'm wondering, from either your perspectives, I wonder if one of the things that causes problems is the language that we use. I mean, you know, we have people where we don't talk about our bowels in polite conversation. We don't talk about our behinds in polite company. Like, you know, there are certain things that we just don't, and whether it's, you know, remnants from how we were raised or, you know, social etiquette, that there are certain things that we just don't discuss publicly. And so I'm wondering if that is one of the things that leads people to not being more proactive or not being more willing to get things like either a colonoscopy, or also, you know, we throw prostate exams into this as well, because of the area body that it deals with, and that we have some, you know, kind of internalized shame over some of these things. Like, you know, do you see this the same way? And are there ways you think we can overcome that?
Well, I think for the prostate, I think every guy needs to know one of the most important things nowadays is actually getting a PSA, which is a blood test.
Right.
So I think every brother should get that blood test starting. Usually we start that at 50, but if you want to do it even sooner, if you ask your primary care physician, they'll probably order it for you. So that's something that we should get every year because you want to see the trend. Right. So that is something to add on. And all the bros that are on this chat, we should probably, you know, spread that word. I talk to people I know about it. So now I know you guys through the chat. So you should definitely get a PSA added on every year. So that way, like he said, even if it's normal range, if it becomes double of what it was, if you were a person on the very low range and all of a sudden it jumps up to the high end of normal, that's enough to be a little concerning as well. So that
Gotcha.
can at least start to work up a little sooner. Now,
Right.
what I will say, prostate cancer is very slow growing. So that's something that's is treatable. You can find it looking at PSA levels. And I think if you had to rank things, it's a little less than the colorectal stuff. You still want to do it, but the colorectal thing can be way more destructive to your health.
Gotcha.
Yeah, and to that point, a lot of times, like with the PSA, the screens that we're doing for prostate, awareness. Like for example, shout out, we do have a health fair that's coming up. This, for example, for those who are in the Chicagoland area, it's called Thrive. So we one of the things that the District of Illinois is choosing as a priority or an initiative that we're focusing on is prostate health. So a lot of the health events and a lot of the health fairs, if you hear us hosting them or doing them, you will be able to usually get free screenings. There's a lot of companies and organizations out there that will provide those services, and they'll give you the numbers, and then you will know they can communicate with your health provider. So we will have that at an upcoming Thrive fair. It's from 10 to 2 at the Chicago Jesuit Academy. I know that the chapter Iota Delta Lambda is also talking with them as well to see if there is an opportunity for us to partner to get some of these exams instead of having to go into the doctor. It may be just easier if you're part of the normal fair. If that's just a blood test, and you can be able to get some information that way as well. But you want to know, and I think to Brother Jones's point, it's good to always be able to have to track trends. To be able to see kind of like, oh, okay, that is a jump between this time and this time. And you don't really know if you wait till a very long time, that number becomes your baseline. And if it's already high, we don't know how long it's been high or when it was that way.
Right.
And I think, like to your earlier point, just in terms of kind of just the anatomy of kind of what to call it or how to relate to it, it can be a little embarrassing. Sometimes we can use different terms, the actual anatomical terms. Sometimes people don't use, but what we refer to it as is important. But I think that, as long as we're communicating in some way with the comfort and with the norm of whom we're talking to is the important part, that the conversation, the dialogue is happening versus not. So, whether it's kind of the backside, I've heard people refer to as like my no-no zone,
Right,
some
right.
people, the rectum, there are, anatomical terms to be able to describe it. But sometimes being able to mention that can come with that psychologically. Am I going to be judged? Is somebody going to laugh at me? What are they going to think? Are they going to, imbue or project onto me certain things about my sexuality, about my masculinity? Just societal norms about how, we discuss or not discuss our bodies and our anatomy. We've been kind of conditioned and trained in society as men, to do so. We see it sometimes with women, but if you notice, like women a lot of times really talk a lot more freely about some
Right,
things,
right.
right?
Right.
So it's very unfortunate, and it's something to be, that we want to be mindful of. How do we talk about it in a way that conveys a level of seriousness, but also that's not something that also undermines or perpetuates really that this is something that we shouldn't talk about, or it's awkward, or to be laughed at or laughed about.
Absolutely. And so my final question is going to be more specific, and I think Brother Humphreys, you kind of touched on it a little bit, and I do want to put an emphasis on something, again, and we mentioned it in his bio, but Brother Dr. Humphreys is the first Surgeon General for the District of Illinois, and I applaud Brother McInnes. Don't tell him I'm giving him a compliment. But I applaud District. Yeah, exactly. So big. But I, in all seriousness, I do applaud him for and thank you, Brother Humphreys, for serving, because this sends a message to others in the fraternity that these are different types of positions within the fraternity that we need to help us advocate and help us follow our mission statement of providing advocacy. And so what I would ask either of you is, what would you suggest that as members of Alpha Phi Alpha, either on the chapter level, district level, regional level, or the general level, what can we as alpha men do period or do better in terms of promoting health issues like colorectal awareness and things like that? You know, what are things that we as a fraternity can be doing or should be doing to help better serve our communities? And I think I'll start this with Brother Dr. Humphrey.
Yeah, no, thank you. You know, I think that's part of a lot of what we're trying to do as an initiative is getting information out there. So there's sometimes national initiatives where like this is Breast Cancer Awareness Month. This is, you know, Colorectal Awareness Month. Like there can be these month where we're focusing and targeting a lot of these health conditions. So please, you know, be patient, but be on the lookout from as a fraternity. What we're trying to do is identify what are some of the common health things that we feel, you know, brothers need to really know about, to prioritize or to take action on, and to get information disseminated to the brotherhood. So there's currently newsletters that go out that talk about a lot of different health conditions or for the month things to think about. They're kind of like monthly challenges that I sometimes pose, like how much water can you drink, holding people accountable. The district director has, you know, really spearheaded a new initiative that we just did for the month of April, where it was Alpha Fit, you know, doing 30 miles, so promoting activity and movement. And so I think in the continuing, it's already happening, but it will be growing in the future. We'll be bringing out more and more information about health in general, things to ask, and resources that we can connect you to people like a Brother Jones if you have questions about, you know, certain things that you might not be able to get to your immediate doctor for. Also, we do have a health committee. So if you are interested in being a part of that, and maybe that's just sharing and participating in fairs or disseminating information that comes from like reputable individuals like myself, Brother Jones, other individuals who, you know, serve or, you know, within the, and people in general, medical professionals in general, but specifically within Alpha Phi Alpha, you know, we welcome you to be able to kind of help to be able to make the fair successful, to promote it in our communities, and to really get brothers off their butt and engage in prioritizing in their health. So there's will be forthcoming additional more information that'll be coming, and word of mouth, and just making it a part of the dialogue that you have. You know, as a brother, how's your health? Have you done this? So you just turned 45, brother. Make sure you go, you know, and get this done, or, you know, things like that to normalize the dialogue and make it a part of our regular conversation. Our health really is important.
And Brother Jones, what do you think we could do as a fraternity to better advocate for our health?
I think when it comes to relationships, health, all that stuff, we have to start acting more like the females. The females always go a deeper level. As guys, we keep it kind of superficial, sports, you know, work, and that's kind of where we stay. That's our lane. But we do need to become more like, you know, brotherly and acting like we're family. And I think anybody who is in the health field, like Brother Humphrey is just saying, we owe it to the fraternity to be that kind of point person. And I try to do that in my chapter. You know, if somebody needs something or has a question, and we all got certain skills, we know certain things, and we have certain accesses, and that's part of the brotherhood. So
yeah,
me getting somebody an appointment with someone really is just sending a text message to my colleague. Whereas for other people, it's getting on the computer, is having to jump through hoops, is getting an appointment 5 months down the line. It's a lot of work for them. For me, it's literally a 30-second text. So that's what I bring to the fraternity, and that's what I'm there for. And there's a lot of people like that in the frat, and I think it's more of a chapter level, and we got to start just treating us everyone like we're brothers. We say it, and we know we all pledged, and you know we know that, but we need to start just acting like we're family. And I think the chapter here, I'm actually in Champaign, Illinois, so that's where I am. So they kind of know that about me, and I think any bro who's in the medical field, regardless of what capacity, that's what we can offer the frat. And I think this needs to be a chapter level thing. I don't think it can go from national to regional to district. You know, I think it has to go the other way around. It starts chapter level.
You know, I'll say something and piggyback on something Brother Humphrey just said. Then I'll and our district director has rejoined us. You know, I had a situation yesterday where I was talking to a brother, and this is related to colorectal issues, but he and I were just, you know, shooting the crap, and he mentioned he was having problems with his foot, and his foot was hanging. I was like, you know, yeah, you probably ought to need to go get it checked out. Oh, I don't know, blah, 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 blah. And, you know, I got a little insistent, hit him up an hour later, and he was like, yeah, I'm on my way to the ER. The reason I bring that up is I think, you know, if in the guise of am I my brother's keeper, that sometimes we need to, you know, help advocate, you know, for those things, even if it's a minor thing. And, you know, thankfully he went and got checked out. There was nothing wrong. And, you know, I think he had too much fun on his vacation, and he probably, you know, took a wrong step, probably tried to step when he shouldn't, because you know how old folks like Brother McKinnis are when they try to step. So but yeah, I think that's one thing we can do on an individual basis. And Brother Jones, were you about to say something, or did you freeze up?
I think he froze.
Yeah. But as I hopefully he'll come back in a second. Gentlemen, brothers, this has been a great discussion, and I really appreciate the information that.
Is that what the music is?
I'm sorry. Oh, yeah, there's a little music going on in the background. But I do want to thank everyone for their participation, for their information. Brother Jones, for giving us his perspective, and for Brother Humphrey, our Surgeon General, for not only being here, but for the advocacy that you do on behalf of the district and the region as well. These things are very important. And also, you know, to our district director, you know, thank you for spearheading and wanting to have these discussions, so we can hopefully disseminate information. And even if people aren't seeing it right now, as Brother McKinnis mentioned earlier in the at the beginning of the call, you know, please share this with someone. Please send this to someone, share it on your social media platforms, or send it as an email to someone. You never know who's going to benefit from it. So before I'm going to really wrap up, I want to give our panelists a quick 30 seconds to kind of give a last point. So, Brother Dr. Jones, if you would like to give a quick final statement.
It looked like I was the one having an internet problem for a second, so I missed a lot of that.
Yeah.
But I think this was a great chat. I think hopefully we kind of changed the narrative more for the way you interact with your physicians from here on out. I really think treating us like partners or treating us like employees will kind of help our population more than anything else. And I think it's good. We'll start to try to get this going more from a chapter level and go from there.
Absolutely. And Brother Dr. Humphrey.
Yeah, I think, you know, just it's an honor to, as always, be able to share the wealth that is our health, and just making sure that we're just mindful of really shifting the narrative. We want to make sure that we're shifting it from stereotypes and kind of fear-driven, lack of knowledge having existence, to strength. So we're not just extending life. I think that's important. Sometimes we're thinking about just extending life, but we want to really improve the quality of how we live it. And so by using these resources and being able to inform yourself of what knowledge is power, and being armed with that will help you to be able to do that. So I just want to put that out there, and definitely reach out to brothers of Alpha Phi Alpha. Reach out to like myself or to other brothers for support, for questions, and to men in general who may be viewing this. Reach out to your community and the individuals who are around you, to surround you, to make sure that you're prioritizing your life.
Absolutely. And thank you again, brothers, and thank you to everyone who tuned in. I want to remind everyone that we will be doing additional fireside chats centering around men's health and health issues. You can catch all of our previous, we've had some outstanding fireside chats over the last couple of years. You can find them all on our YouTube channel, which you can find by going to YouTube and typing in Alpha Illinois. And we invite you to peruse any and all of those to see the work that we've been doing here in the District of Illinois. And with that being said, Brother Dr. McInnes, I will turn it back over to you.
Brother Smoot, thank you so much. And to our panelists, Brother Murphy and Brother Jones, thank you both for giving us some of your time tonight. I'm lucky. I get to be in Champaign with Brother Jones, and if I got something going, I know what I'm doing. So
you can always hit me up, bro.
I know.
We appreciate having you in town, so you know how that is.
This has been fantastic, brothers. Let me thank all of our guests for joining us tonight, a part of this really important and necessary conversation. As Brother Smoot mentioned, follow us on District of Illinois Alphas on YouTube. There is a plethora of previous fireside chats that you can watch at your convenience, and be on the lookout for more as we continue these important conversations and many more. So, to all of our guests, thank you. To the panelists, thank you. And to Brother Smoot, once again, brother, for your partnership in these fireside chats. The district thanks you very much. And with that being said, good night to all of our folks out there in the virtual land, and we'll see you next time by the fireside.
All right.